how's it going?
Hi, how you doing?
Good, my name's Dylan. I'm a third year nursing student from UOW and I'm just here on my clinical placement, so I'm going to be here for a couple of weeks with you guys.
Yep, okay. Sorry, my name's Christian. I'm one of the RNs here.
Oh, nice.
Yeah, so it's nice to have you here. So you'll be paired up with me today.
Okay, great.
So we've got a couple of patients, but one in particular I might need a hand with.
Yep.
He's a 23-year-old male. His name's Adam.
Okay.
And so he's recently suffered some spinal injuries after falling off a house while intoxicated.
Yeah.
So today, if it's not too much trouble, I might just need you to do some just some general duties and maybe some observations, wound care. Is that alright with you?
Yeah, sure, no worries. We can
Great,
get that
no worries.
done. We'll we'll go down to the patient and have a look, introduce myself to him.
Yep, no worries, let's go.
Great, let's do it.
G'day Adam, how you going today?
Not bad, thanks mate. How are you?
Good, thanks. It's good to hear. Listen, I've got a nursing student with me today.
Yep.
Okay, Adam. My name's Dylan.
Dylan? Adam, nice to meet you.
Nice
mate.
to meet you too. I'm a third year nursing student from UOW.
Cool.
Yep, so Dylan's going to be with us for the next couple of weeks.
Yep.
And yeah, so we just wanted to make sure that it was okay if he participated in your care over the next
Yeah,
couple of
that's not a problem, mate.
Great,
I'm
thank
fine
you.
with that.
weeks. Okay, awesome. So listen, we're just going to go get the day started.
Yep.
We'll come back and check on you.
Alright, cool. Nice to meet you,
Thank
Dylan.
you too. We'll see you around.
See you soon.
Thanks, Adam.
G'day, Adam.
Hey Dylan, how are you, mate?
Good. How are you doing?
Yeah, not too bad,
Yeah,
mate.
that's right. How's the back been holding up?
Yeah, it's a little bit sore, but
Yeah.
it's bearable at the moment.
No. How did that happen to you, mate?
Yeah, look, it was a party that got out of hand.
Oh, yeah?
On the weekend, I thought it'd be a good idea to climb my mate's roof and
Oh, jeez.
kind of slipped off. Went backwards. Had a few too many. How'd you do on the weekend?
Oh, it gets like that sometimes, doesn't it?
Yeah, it does, man.
Is it right
Regretting
if
it now, but
Yeah. Is it right if I just pop this on
Yeah,
you?
yeah,
Take your
that's
blood
fine,
pressure and
man.
that? Yeah.
Go for it.
So was it like a big party or?
Yeah, it was my mate's 21st.
Oh yeah, that's nice. Would have been a good showing then.
Yeah, well, it was until I fell off the roof.
Yeah. How's that? That's alright?
That's a little bit tight.
Yeah.
It's good,
Good
also.
stuff, yeah. How's that?
That's good,
That's
thanks,
Alright,
man.
no worries, mate. I'll just start this machine up, and I'll pop the oxygen saturation on you too. Get that all going.
Yep. So what year are you in, Dylan?
I'm in my third year.
So you're almost done, dude.
Yeah, this is my final year. So after this, hopefully if everything goes well and I pass everything, I'll be registered.
Have your
as-
license, yeah.
Yeah, so I'm looking forward to that. Should be a good experience. Yeah. So tell me a bit. Yeah.
Shit, that's a bit tight.
Oh, sorry, man.
That's right, dude.
It's just the cuff's just going to inflate a bit and then it'll drop down and relieve
Yep.
some of the pressure.
No worries.
Great. The oxygen saturation's looking good.
Yep.
Heart rate's fine too. So happy days with that.
It's
Just wait
always
for the,
good to see, man.
yeah, I know. We'll just wait for the blood pressure to read and then I'll be out of here. Let you get some rest.
No worries.
Alright, great. It's looking all fine. Alright, sweet. Oh. Alright, cool. It's looking all good. I'll
Yep.
just record it all back in the station and I'll unplug you and let you get some rest, alright?
No worries. Thanks,
No
Dylan.
worries, man. If you need anything, just give the buzzer a bit of a call and I'll come and
Yep.
give you a hand, alright?
Yeah, I will. No
Sweet.
worries.
Thanks,
Thanks, mate.
Awesome.
Yep, come in.
Hey, how's it going?
Hey mate, yeah, good. How'd you go?
Good. I just did Adam's obs and I just recorded him on the obs chart if you want to have a bit of a look. They're
Yeah,
all
yeah,
between
sure.
flags, so
Okay.
should be nothing to worry about.
Okay, good. So you getting along with Adam?
Yeah, Adam's cool. He's a very friendly, nice fellow.
Yep.
Yeah, he's doing alright. I just felt like maybe he was a little bit over familiar with me. He felt at one stage.
Oh, really?
Yeah, I don't know. It's probably nothing to worry about, but
Okay.
I just thought I'll bring it up to you.
Okay. Well, look, I personally haven't experienced that with him.
Yeah.
But I'm sure, yeah, he's a friendly guy. And look, you're a new face. He's been in
Yeah.
here for 2 months. Do you know
That's
what I
right.
mean? So I'm sure it's nothing to worry about.
Yeah, that's fine. No
Just
worries.
see how you go.
See how it goes.
No worries.
Alright, cool.
Thanks, mate.
Thanks. Hey Adam, just answering your buzzer, man. How
Yeah,
can I
well,
help you?
My hobbit feet are a bit cold, and because of my spinal, I can't bend down. Can you just cover them up for me, please,
yeah.
dude?
No worries, man. I'll just pop that there for you.
Thanks, mate.
It's alright. How's that? It's
Yeah,
better?
it's not bad.
Yeah?
So,
Good stuff.
do you live local around here, or?
Yeah, I do actually. Yeah, I'm just from the area, man, just the Elora
Yeah,
region.
what school did you go to?
School? Yeah, just a local school.
Yep.
Around the area.
Okay.
It was a sports high school actually.
Yeah. Do you live
Yeah.
with your parents or partner?
Yeah, I got a unit around
Okay.
here too.
Oh,
Yeah,
cool.
so I'm just
By
yeah.
yourself, with anyone?
Yeah, just
Just by yourself?
Yeah. How's the back been going, man?
Yeah, dude, it's a bit sore, but like I
Yeah.
said, it's still bearable.
Oh, alright, yeah. Don't need anything for it yet,
No,
I think? No?
I'm good, thank
Tolerating
you,
it
mate.
fine?
Yeah, I'm alright.
Okay, no
So
worries.
what do you like to do for fun, dude? Like, you
Yeah.
out drinking with the boys?
Oh
or-
yeah, man. I always go for a nice piss up with the boys
Yeah.
and that, but nothing too crazy like
Nothing
you
too
falling
crazy.
off roofs, you know. Yeah,
Yeah, no,
nothing
no.
like that. But
So, you single or you seen anyone or?
oh, I'm seeing someone at the moment.
Are you seeing
Yeah,
someone?
yeah, I am.
Guy or girl
Oh, girl.
or girl?
Yeah,
okay,
yeah,
good, good.
All right, I'm just gonna go into the other buzzer, man. So
Yep.
I'll be back around
Alright.
soon. All right,
Cool.
thanks, man.
I'll see you soon,
See ya.
man.
Oh,
Hey mate, how are you?
good. How's it going?
Yeah, not too bad, not too bad. It's lunchtime, so
yeah,
it's good.
it's happy time of the day, isn't it?
Yeah,
Get
it
a
is.
good feed.
Yeah, it is.
Get a bit hungry.
So what's going on with Adam? How's things? You've been going really well with him.
Yeah, thanks. Yeah, Adam's cool. He's fine. He's been alright.
Yep.
I've been answering his buzzers a couple times throughout the day.
Yep.
Yeah, I just went and answered one of his buzzers recently, actually, and it was just to pull because he can't bend because of his spinal injury.
Yeah,
So it was
yeah.
just to pull his sheet over his legs again because I think
Yeah.
he accidentally kicked it.
Yeah.
And yeah, he's just some of his questions he was asking me, a bit personal. I didn't know how to handle them. Just like I don't know, some stuff. I'll give you a couple examples. Just like for instance, he was asking where I'm from, where I live, and if I have a partner, and if my partner
Really?
is male or female,
Okay.
what school I go to.
Yep.
So yeah, I didn't really know how to handle that.
Yeah.
I tried to bounce a couple of them off. So
Yeah. Well, look, that's where it gets hard because
Mm.
the thing is, when you have a patient that comes in and they consent to care, they've automatically given you that little bit of control, if you know what I mean.
yeah,
So it's actually crucial that we as nurses make sure that we set these boundaries,
okay,
and that way we can sort of respect the space between our professional power and their vulnerability.
yeah, okay.
And the thing is, I mean, in that way you can make sure that you can make a safe connection with that patient, and that way you can provide that care with them, in a safe manner that maintains your professionalism at all times. And it can be hard. I mean, I understand that going forward as a student nurse, it may be hard for you to assert yourself in a certain manner with
Yeah,
people.
that's right.
And
It is
and while it is something that you do need to learn, and I would encourage you to sort of go and use it as a learning tool for yourself, to try and assert yourself in this situation. I can understand if it's a bit uncomfortable, and by all means, I can take you off that patient, and I can move you to another patient if you like.
Yeah, well, we'll see how it goes. I mean, we'll wait it out, and if anything else happens, I'll let you know.
Yeah. Okay.
It's,
Alright, well I would recommend you go and try and assert yourself and
Yeah.
see how you go, but any problems let me know because something does need to be done.
okay, yeah. So if it carries on, I'll see what I can do, and I'll report back to you. And see
Yep.
we'll go from there.
Yeah, please do.
Alright, great.
Okay,
Thank you.
no worries, thanks mate.
Cheers. Hey Adam, how's it going?
Hey, Dill, how are you, man?
Good, good. Just answering the buzzer.
Yeah, you're looking real professional with your stuff.
Oh,
going there, eh?
thanks,
Yeah, like a
man.
young, good-looking
Yeah.
nursing student.
Oh,
Hey,
cheers,
look,
Yeah.
what are the chances of you just pulling my blanket over my feet a bit more? It's
Oh,
just
yeah.
come a bit untucked, if
Yeah,
that's
no
okay.
worries, I'll do it for you, man. How did that get untucked? Just
Because of my
yeah.
spinal rod, man,
Oh,
I'm just
yeah.
a bit fidgety.
Bit
and-
fiddly.
Hey,
Alright, cool.
what are the chances of getting another blanket? I'm just a bit cold.
Big call. Yeah, no worries. I'll grab
And
one for you.
just as well, a
Yeah.
pillow. Like, is there a chance
Yeah,
of getting
no
another pillow?
Sure, I can grab you another one.
And
So grab-
also
grab
just,
it there,
just a
steady.
glass of water.
Yeah, no worries. I'll be
And-
back with it, alright?
Yeah, alright.
Sure.
Just one more thing, dude.
Yeah.
Sorry. Some Panadol for my back, maybe.
Alright.
But you know what'd be good?
Yeah.
Like a bottle of scotch or whiskey.
Oh,
Look, do you reckon, between you and me, yeah, do you reckon if I gave you some money, you could sneak me in a bottle of scotch?
I don't know about that, man.
Oh, come on,
I'll-
don't be...
I can go and get the pain medication for you with the nurse, and I can do all your other requests.
Bro, you're a good-looking young guy. They won't say anything. Like, look at your
Yeah.
arms, man. It's like you work out, you go to the gym.
Oh
and-
man, I don't know if I can do that for you. Sorry,
Sure?
buddy. Yeah, sorry, man. I'll do all the other stuff for you.
Well,
but I
go
can't
for it.
grab you.
I reckon there's a chance you could.
I'll be back soon with your
Alright,
pain medication.
alright. I'll talk to you soon,
Alright,
Dill.
thanks, man.
See if you can, man. Don't
Alright,
forget.
G'day, Adam. How's it going, mate?
Hey, Dill, how are you, man? How'd you go with the scotch?
No good with the scotch, buddy.
You serious?
Yeah, I did get the water that you requested.
No,
though.
man. Screw your water, dude. Like, honestly, I'm sick of this shit. What, I can't just have like a little glass of scotch?
I can't get you any scotch at all.
I'm just sick of this shit, man. I've been here for 2 months, and this orthopedic surgeon, this Humpty Dumpty looking idiot, he has no idea what he's doing. He's the best of the best.
Yeah.
And what, like, see,
You're
like,
right.
I'm still in pain, man. Like,
Yeah.
what's going on?
Sorry, man. Do you mind if I just have a seat and have a bit of a chat to you?
Yeah, go
Yeah?
for it.
Alright. So the whole request with the scotch, Adam, you see, as a student nurse
Mhm.
practicing to become a registered nurse,
Yep.
it's out of my ethical and legal duties to fulfill requests such as those to you. I can get in a lot of trouble for fulfilling requests.
Yeah, but
such
who's
as
gonna
those.
know, like, if you sneak it in?
I mean,
Put it in your bag and just pour a little cup and, like, come on, dude.
I can't do it because if anyone sees me at all, I'm done. I'm done. You know what I mean? And also another couple things I've been noticing. We have a good rapport going. We have a good
Oh, we
relationship.
don't now.
Well,
We did.
We did.
Past
Yeah.
tense.
Yeah, we did have one. All right. And I want to keep that going. You know, so I can provide the best care to you that I can.
Mm-hmm.
A few things I've noticed. Some of the questions you've been asking me, I think they've been stepping over some certain boundaries. You know what I mean?
It's just a bit of fun.
Yeah, I know it's a bit of fun for you, but like for me, I'm, you know what I mean? Just in terms of being
What?
legal rights, ethical rights, and just providing a certain duty of care to you, I'm unable to answer questions such as those because it's just a breach of privacy.
Yep.
And also fulfill requests such as smuggling in scotch to the ward. I'm unable to do those kinds of duties for you, buddy. Like I can fulfill requests such as medications and cover you up with more blankets and get water for you, but stuff like that, man, I can't do it.
Yeah, look, I
I'm
understand,
unable to do
dude. Look, I understand.
Sorry about it.
No, it's
but
alright, it's all good.
You know what I mean?
If you don't
It's
mind, I
just-
just want to be left alone for a while,
Yeah.
man. I appreciate it.
Alright, buddy.
Alright.
No worries.
Thanks, Dylan.
Thanks for understanding, Adam.
Come in. Oh, Dylan, how are you, man?
Good. How's it going?
Yeah, good. How's things going?
Yeah, not too bad. Not too
Yeah,
bad.
how's the ward?
Yeah, the ward's cool. I was just with Adam then recently.
Oh, yeah, okay. Yeah, so how'd things go with him? Did you end up having a chat? Or?
Yeah, I actually did, yeah. Just then, came straight off it and I came back
Yeah,
to have
how
a
are
chat
you,
to you
alright?
about it. Yeah, I'm alright. I think I handled it alright. I
Yeah?
guess. Yeah, first time in that kind of situation. So
Yeah, okay,
it
can be a bit.
It was a bit nerve-wracking, you know what I mean? But I think I did fine.
Yeah. So what'd you tell him?
Yeah, so he actually requested me to grab him some scotch from the liquor store, but I told him that I couldn't do it. I explained to him why I couldn't do it. So basically, and also I brought up, you know how we're talking about the inappropriate comments that he was throwing around, the questions and that. I brought that up to him as well, and just why I'm unable to answer those kinds of questions.
Yeah.
And why I can't bring in whiskey and that, just because I told him it's a breach of duty of care, and I can't fulfill those requests to him or for him, but I can do other things for him, like getting water and medications and stuff like that.
Yeah.
But
So you said no. You stood your ground.
Yeah, that's right.
You gave him reasons why you couldn't, and you made sure he understood those reasons.
Yeah, he did understand, because at the end of it, he was pretty compliant. Like he still had the shits a little bit, but you know he was fine with it. He just wanted to be left alone for that.
Yeah. Okay.
And I left the room quietly, and he was fine with it. I'm pretty sure.
Okay. So we got the reasons, and you also brought up the ethical guidelines.
Yeah.
And you brought up the legal.
Yep. Legal standpoint of it all.
Yep. Okay.
And how it could affect my practice going ahead as a RN as well.
Yeah. Okay. So all these things they're going to impact on the care of the patient, as you know.
Yeah.
And you've sort of outlined that to him in a roundabout way.
Yeah.
But for yourself, knowing that you just got to know where you stand as a professional compared to a patient, and just respect the boundary between yourselves, because as we just said, it's going to help you sort of deliver that patient-centered care in a safe way. So
definitely right.
That's good. But see how he goes. I mean, he's obviously still a bit annoyed, but just it'll pass. It'll pass. But I'm sure you said he understood. And
that's right.
Just got to give him some time.
Alright, sweet.
Yeah, awesome. Well, see how you go.
Yeah, we'll do.
No worries, mate.
See you around.
Students have a strong need to debrief immediately after a clinical simulation. This allows them to decompress and integrate the experience into their knowledge base. The objective of this is to offer a learning opportunity to link theory and practice. As we don't have sufficient time to conduct a detailed debrief, we will be utilising the SHARP model of debriefing. This is a practical 5-step tool to facilitate reflection and lead to new understanding.
Alright, so before filming the role play, we discussed and set learning objectives in relation to the marking criteria. So on that note, I might ask you guys, how did it go? What went well and why?
Yeah, well, first of all, my name's Dylan, and I played the student nurse. Yeah, thank you.
My name's Jack. I played Adam, the patient.
Christian played the RN.
Awesome. What was the question again, just real quick?
What went well and why?
Okay, I think the majority of it actually went pretty well, just because we're able to buckle down a lot of the scenes in the first take.
And we worked well together too.
Yeah, we did.
Yeah.
We bounced off each other a lot, which was good. that helped us.
We had a few
give us
bloopers, but
Yeah.
we got the job done.
Yeah.
You might see him at the end of the film.
Yeah.
Awesome.
Yeah.
So overall, a pretty positive experience, would you say?
Yeah,
Definitely.
I think we tried to. We didn't try and like pre-think it. Like
Yeah.
we just sort of tried to do it.
Kind
off
of
the cuff.
improvised it. I
Yeah,
think, a
because
little
I
bit.
sort of think we tried to draw on knowledge that we sort of thought, was there,
Yeah.
rather than try and just regurgitate
Yeah, that's
some
right.
stuff that we learned.
Exactly right. I agree with that.
Yeah, and then sort of we used that as a tool, had a look at it, and then went back and tried to figure out exactly what was, what should have been said that we didn't say, or things like that.
Yeah.
I think just use it as a learning curve.
Awesome. All right. So bouncing off that, then, so addressing concerns. What didn't go so well?
Just one of our scenes
Yeah,
specifically,
the second last
where
one.
Adam asked for he returns with the water, and Adam asked about the scotch, and I, playing Adam, hit the scotch the water out of his hand. That took us quite a few shoots.
Yeah.
Yeah.
Yeah, I think certain things that maybe I should have said, or I should have worded things a little bit better, but I think like overall
Yeah.
it was alright.
Yeah, like I noticed that I stumbled my words. I started a bit.
Started.
Yeah, I started a bit during it, but that fit the role well of a student nurse, because that's just a good reflection of a student nurse. You know what I mean? Yeah.
Absolutely. All right. So I guess in retrospect, do you believe that you met the outcomes for the role play activity? Or,
Definitely.
I
yep.
think we did. Yeah.
I think we did, definitely.
Yeah.
Yeah.
All right. And did you learn anything about the technical skills involved in boundary setting? Would you say?
I think this is probably where, going forward, someone who's a student or even an RN, somebody in that position, I think from what you can see and learn from the video, you can probably take those skills and apply them differently in the future. Say I would personally apply them sooner, so I would sort of try and assert myself in a way that clearly define my role as a nurse. As a nurse, and then sort of establish that boundary between the nurse and the patient earlier. That way, I mean,
That's
Jack
like for me as
Jack
well.
wouldn't have been so familiar,
Yeah.
maybe, or so
Adam.
Sorry, Adam. Yeah, things wouldn't have been so familiar that he felt comfortable with asking for the alcohol.
Yeah.
So that
so I interjected
situation.
earlier on in the scene
Yep.
instead of later on in the scene, then maybe that whiskey question wouldn't
Yeah,
have
yeah.
come up at all.
Rather than have that over familiar sort of relationship, you need to have the professional boundaries, because otherwise it slips into the, oh hey mate, can you get me this? I thought we were friends type thing. So I think that might definitely be better next time.
But he also displayed really good disengagement skills in certain scenes where things got a bit awkward. For instance, that one was like, I've got to go answer the buzzer. When Adam got a bit inappropriate, he disengaged really well.
Yeah. And as we sort of summed up, like you did give reasons. You didn't just leave him hanging and saying, hey, I'm not going to do this for you for no reason, because that's not going to benefit the rapport either.
Yeah, that's right.
Awesome. All right. Well, moving forward, then we're in our final year of nursing.
All right.
We're going to be RNs pretty soon. What actions do you think you can take, like, to ensure continued improvement? What are you going to take from this assignment and apply to future practice, do you think?
I think going into a situation now, having run through almost like a dry run of that sort of situation, I think it will definitely help in the future if you get some, not somebody like that, but a situation like
Yeah,
that.
if there's a certain situation going ahead in our practice as an RN where we do have to set boundaries, then I can actually see myself reflecting back on this assessment and applying some skills that I've learned from this assessment into the real world.
Yeah, saying what was good, what was bad, and then filling the gap, I guess, in a real life situation.
Cool.
Awesome. All right. Good job, guys.
Cool.
Sweet.
Thanks, mate.
Thank you.